Nurses and midwives suspend nationwide strike. And then GRNMA, that is a Ghana Registered Nurses and Midwives Association for a video be better one thing say almost strike almost call you just over a week now no almost call you of strike no video no ha you be video no the way you run 7 money a share adentia afiaba no say almost 6 strike no almost calling it off. And what is the reason behind it? Hi NyMedia. Send your first message so be like no share no comment so e dia mame. Afi yenko tie a GRNMA for mo video mo ye ba bedi nkomo.
Good morning, fellow colleagues. Our dear nurses and midwives. Good morning to our employer. Good morning to the Parliamentary Select Committee on Health. A very good morning to all Ghanaians. This is a press release on the suspension of our GRNMA strike. The leadership of the Ghana Registered Nurses and Midwives Association embarked on a roadmap of industrial actions on 2nd June 2025 with the wearing of red arms to headbands, followed by withdrawal of outpatient department and emergency services, which culminated into the total withdrawal of all nursing and midwifery services on 9th June 2025. Our demand from our employer was simply to have the collective agreement of Ghanaian nurses and midwives, which was signed in May 2024, duly implemented without any further delay in seeing our patients suffer. However, we cannot take good care of others when the system does not take good care of us. 3. The GRNMA is a non-partisan professional association and trade union and the holder of the collective bargaining certificate covering all nurses and midwives in Ghana. In its 65 years of existence, the Ghana Registered Nurses and Midwives Association has never aligned with any political party in Ghana. Rather, it has worked with every government since 1960 in building a stronger and more resilient health system responsive to the health needs of Ghanaians, whilst at the same time, we representing the interests of nurses and midwives in matters related to their welfare and general working condition, and has paved the way for an amicable resolution of the impasse with our employer concerning the implementation of our collective agreements. Parliamentary Select Committee on Health for their timely intervention to set a clear framework for the implementation of our collective agreements. We are equally grateful to the nursing and midwifery fraternity, especially our GRNMA members, for the deep sense of solidarity in adhering to the roadmap.
Video you share sama GRNMA, Ghana Registered Nurses and Midwives Association for adi ababon ti omo di ababetudwa. Na the omo kan nyina ne say omo somewhere around last year May and omo ni aban kon hye say omo conditions of service any nyoma bi kan on aban ebe yanka the government should improve it for them. So they agreed with the government that was around last year May. Unfortunately, about the last year government Abayane also MPP Abayano couldn't enforce the agreement on Mukoye, and there was a change of government. I NDC for Ababemo. As NDC for Ababemo na fe the mobile say then we should now renegotiate. I don't know the more amount of the call strike and call strike I think it's been like almost over a week now. Ana omudi call strike, but then omatena say unu say no omo dwene Ghana for omo dwene sebi ayare for ho ene maame for omo maternity ward ni omo dwene omo ho nyina nti no say no, then they are now calling off the strike. Said the bear nurses ne midwives are omo joining, that is the GRNMA for nyina be call back to work to be able to attend to a patients at Beba Hospital. Now this thing no also in the video before I say me view crab, I just want us to appreciate in some of your two channel. And also in the video no so no see they are not in support of any government, or whether and also they are not against any government. So the two just say for over 60 years now they have been in operation. Since 1960 they have worked with all governments, and people should not look at it say and this they are trying to make the government unpopular. And into normal if I saying I engage this strike no, and I said into normal back here strike action no, but that was not the case. Omo GRNM they are not partisan. They don't act on political basis. You see, what I think is that this is not the first time something like this is happening. Kamia say Omaya Timono, someone steady pa Sabanfo Frobia bar. Then it looks like we have certain, surge of politics, if I'm saying strikes, we agree with the government this, and then sometimes this is not the first time. And I believe it's about time Sanima in a tucha. Or my 60 years plus, we shouldn't be tolerating some of these things. Say, buying wababemu. The previous government, government is continuous. Yes, even though the party may change, the people there in government may change. A buying and kasadi a continuous. And it's if there has been a change in the ruling party, that is the party of the day, does not mean say there was an agreement previously. Now, bad, then we have to cancel everything. This attitude of us cancel, if I say, for example, a project can be started by maybe the MPP, but NDC Baba Bame was NDP before they started the Amebame to also, and vice versa. I also NDC for best started MPP was meant to also. This attitude, yemfa embo my. This particular attitude will not help us, because say under GRNM before. Imagine, you see, this is almost services in an essential service. There was a report to cry about on things that people have died as a result of nurses not attending to them because nurses are on strike. And imagine say such an essential service, it is say nurses and midwives. Na yesioma ko strike adia omo per se improve omo conditions of service, and then the government is reluctant about it. Just imagine. So I believe it's this particular issue of strikes in terms of, especially when it comes to essential services, the government must really look at it. And yes, because or no politician or yari apa you be flew straight to abrochire so onko sa ne ho yare enti ono no if any say sa hospital ne baby I ono onko hobi. We are the ones who are going to suffer. So I believe it is hard time my politicians and they will take us serious. So on the other note, so I think say it is a good move by the GRNMA. So if you cancel striking in India, if you count more cancel strike, almost say or more Ghana for one. And the question is more best starting more one. That is another question too we can ask. But then on the more serious note too, I think say it is a good step they cancelling it, and hopefully some cancel no nothing now buying because some cancel the every shady money buying will be almost so much. No, I think say they should go back to the drawing board, try and settle all more issues be I said they be obi akoma be de betoni yem. Enti onua hana me do be see my NyMedia more reviews or be like share, no subscribe so e dey ma me. Macron.